First round of chemo is over, so today I want to talk a little bit about the side effects. I also want to just talk about all the alternative treatments that people talk about with regard to treating cancer. So let's tear into it. So I had the pump on for 2 days. Over the course of those 2 days, it injected more of the chemo into my system, and few little side effects that I noticed. One was a tingling in my fingers, and in fact I'm still noticing that today. If I touch something a little cold, it's kind of almost like an electric shock. Also, there was there is still a little bit of constriction on my vocal cords. It seems like my voice is a little bit different, and if I drink something cold, so there's a very noticeable even if it's not cold, it feels a lot colder, feels kind of different going down my throat, a little bit of a taste in my mouth. Beyond that, I don't really notice a lot of difference. I may be a little more, maybe I'm a little tired, more tired than I was before, and I think that's about it. So nothing really exotic. Now I'm told that as these treatments go on, that the effect is cumulative, so we'll kind of pay attention to that, and I'll keep updating, reporting, and let you know how that plays out. There's a lot of alternative treatments I'm aware of out there. I've spent a lot of time over the last several years, actually over most of my life, studying health and fitness, among other things, but I think I've done a very good job of educating myself about health and fitness and about diet especially, and I am aware, as I said in one of my previous videos, that I believe it's very likely that some of the things that I've done in my life probably contributed to this condition. One of the biggest things I made, which was probably the biggest mistake I made, was not going in and getting a colonoscopy as is recommended much earlier in life. Probably in my 40s would have been a good time to at least start doing that, because then it's quite possible that I could have just had a polyp, could have been removed, and then I wouldn't be faced with this right now. So if there's anything I would recommend to anyone out there, it would be get a regular, once you start getting older, it's probably worth your time to get that procedure done, because it's really not that big of a deal, and it could save you a lot of grief later in life. As far as the alternative treatments go, I am very aware of all of the things that are out there, the Gershons, there's just tons of things. And if I had time, if I had a much earlier stage diagnosis or something, I probably would be more inclined to push towards that and just not do the chemo. But I've seen the pictures of my tumor. Basically, my colon in the area where the tumor is down to a very small size. Which causes some problems, and it's a pretty big tumor. And it's not like I have years to let my diet or some other alternative treatment just magically shrink this thing away. I don't think that's going to happen. So and for all of us, that's a decision. If anybody gets this, it's a decision you're going to have to make, is do I have time to try something different, or should I go with what I know is likely to be miserable, but is probably also a pretty good chance of fixing my problem. Colon cancer, it does have a fairly high survivability, and again, is in the condition that I'm already in, I think I have a very high likelihood of survivability and probably cure of this cancer. So going forward with that treatment, not because I don't think there's a lot of value in all of the alternatives that are out there. It's a question of time and effectiveness, and so that's why I'm going down this road rather than chasing those other things. But in conjunction with that, I am aware of what my diet needs to be, and if I have a leaning, I do understand that cancers are fed by sugars and things like the processed foods that in effect are sugars, and so having a clean diet is a big part of how I'm approaching this, and probably leaning more towards the paleo keto type diet. Initially on, it was a pretty big desire for sweets, but I'm kind of over that now and moving on. And I think probably more important than even diet is mental state. Now, again, this is just my opinion, but I think there's a lot of data to support that how we feel about things, what we believe, is probably one of the biggest factors in our outcomes in anything. It's in business, in fitness, in relationships, just everything in our lives. Our beliefs probably push more towards the end result in any of the things that we encounter in life than everything else. If you believe you're going to succeed, if you believe you're going to achieve, if you believe that you can do something, then you probably can. And just like if you believe you can't do something, you probably can't. So focusing on the beliefs, I think, is a big factor for us in everything in life, not just overcoming illness. So this was just an update video. I just want to again just keep document everything that happens as a result of the chemotherapy and the treatment. Feel pretty good today. No, all of the symptoms of nausea and vomiting and all the things that they said could happen, haven't had any of that happen. We're now 4 days into the chemo, and now I won't have another treatment for another about 10 more days before I get another treatment, and then we'll see if the cumulative effect is a factor in this or not. And we thank all of you for watching these videos. I hope this was, again, giving you good information that you can use in not just in treating any disease you might have, but also just in life in general. And again, if you like these videos, if you get value from these videos, please share them, and thanks for watching.